Good day, my dear undergraduate students. Welcome to the class on gangrene intestine. It can be kept as a gross specimen or a specimen for the Viva voci, and it by itself is a theory question. The lesions that I shall be handling today will be the volvulus, again gangrene in a case of Ascariasis. Intersusception is something that we people should know. And always do remember, every page carries an information. You should know what this is. And incidentally, go to the playlist if you want any particular information. Now, what is a volvulus? It is the twisting of the intestine around itself using the mesentery as an axis. It can occur in the small intestine as well as the large intestine. Large intestine more common in the sigmoid colon, it is said. Now, as a student, how do I distinguish between the small intestine and the large intestine? A common question that is asked. The large intestine is large. It has got a larger diameter. There will be tags of fat on the external surface called appendices epiploicae. Also, you find that there will be bands of muscle called as tinea coli, which will be leading to the appendix. So once you see the appendix or the anal tag of skin, it is a large intestine. The small intestine, on the contrary, is narrower, several meters long, and devoid of fat. Look at this picture. As I told you earlier, this loop of the intestine is rotating around itself using the mesentery as an axis. A support is needed. And at this region, there is a constriction. And look at the appearance. This is reflected radiologically like this. So I find it has got a groove and then the two loops over here. This has been called a coffee bean appearance radiologically. Questions like this can come in the NEET or the next. I would like you people to kindly draw this as well as the previous diagram in your records, as well as the answer sheets. Look at this one. It is a small intestine, several meters long, and it has coiled around itself. And these are multiple segments or the loops of the small intestine. I find that there is a grayish or a purplish gray discoloration, whereas this is a viable, live, normal area. The junction between the two will not be very clear. So this is the description. I would like you people to loudly read this out and write it. Segment of the intestine measuring so many centimeters long. It is ballooned out, external surfaces, black and shiny. It appears twisted around itself using the mesentery as an axis. This is a surgical specimen. And this is being taken out. Compare it with the viable segment that is within the abdomen. The live ends are pinkish, not edematous. However, the border between the two cannot be very easily identified. That is the risk in doing a surgery. They will be sending it to the pathologist to find out whether the resected ends are viable or not. Again, describe and justify. I am finding loops of the intestine, and these are the mesenteric blood vessels. Normally, whenever there is a rotation, there are two vessels to a region. One is an artery, the other is a vein. The veins are more easily compressible. Therefore, the blood does not leave the region. Arterial blood, in turn, cannot enter. The blood is utilized. It is devoid of oxygen. That region, it becomes gangrenous. Brackish or grayish black, edematous, shiny. Look at the reflection of the light in this region. And I would like you people to note the mesenteric vessels. It is an emergency situation where surgery is a must. Edematous because of venous stagnation. Foul smelling. because of the decomposition, growth of the bacteria, putrefaction, and the production of hydrogen sulfide. It is black in color due to hemolysis of the RBCs. These are three important points which you people should have in mind. This again, not so bad as the previous case, but then the surgeon has noticed it in the early stages. Patient would have come with symptoms of bowel obstruction, abdominal pain, and maybe in a state of shock. This is what is identified, and this is the reference for this particular case for your eyes only. This is another condition of a wet gangrene. Always in the intestine, there can be a gangrene because of a strangulated hernia. Hernia is nothing but an abnormal protrusion of a viscus through an opening. That is called hernia. Sometimes the patient will push it back. It is called reducible. Sometimes it is not reducible. But in certain cases, it becomes strangulated and it becomes dangerous. It can go in for a gangrene. So emergency surgery is mandatory. This is a diagram of an intersusception. Intersusception is nothing but a loop within a loop. This is the proximal intestine and this is the distal part of the intestine. Now what happens when a patient is under an anesthesia, etc.? You find that the entire intestine is also without any neurological stimulus. But once he starts recovering, part of the intestine, see this region, it starts the peristaltic contraction. It keeps on contracting, whereas this area has not recovered. Therefore, it powerfully, it pushes itself into the distal segment. This is called intersusception. So this loop of the intestine or part of the intestine that is called as intersusceptions. And this is the intersusceptum. The entire lesion is called intersusception. So this you people should remember. It is a surgical emergency question for you in surgery. And also there are two other examples. Any organ that has got a peduncle and then the blood vessels in it can undergo what is called as torsion. It rotates around itself using this stalk as a mode. It can occur in the torsion of the testis, torsion of the ovary. Torsion of the testis is another gross specimen for us, leading to gangrene. Food for thought. Always we people like noodles. And I hope you people will like this noodles over here. Don't think it is Chinese noodles. It is something else. It is the intestine. The patient has presented with severe obstruction, vomiting, and abdominal pain. And when the surgeon opens it out, he finds that there is a coiled mass of the parasite. A coiled mass, entangled. So you cannot separate them that easily. And obviously, this is leading to an obstruction. This also can lead to an intersusception or an obstruction totally. An abdominal emergency, see it is opened up and I'm finding, can you count the number of parasites? I have got one such specimen for our college from Pondicherry. And it is there kept for the exam for the students. Go to the playlist for any of the details. The complications can be obstruction, intersusception, gangrene. So the specimen, it can turn out to be black in color, which means it is becoming gangrenous. And this is our friend, the Ascariasis lumbricoides. Females are longer and the males are shorter, and there can be a hook-like structure so that it is helping in copulation. The rest of the details you people can go to parasitology and read. So the previous description will be segment of the intestine measuring so many centimeters long. External surface is grayish black, congested, and the lumen is packed with parasites. The parasite has got a pinkish hue, rounded contour. It is not flat as in the case of a tapeworm, and the ends are tapering. Look at this one, tapering, pointed. And these are the references for this picture. Thank you. Contempt is a kind of gangrene which, if it seizes one part of a character, corrupts all the rest by degrees. Many of us develop a contempt and then the whole personality becomes something like that. Similarly, if there is a gangrene of the intestine, one part becomes gangrenous, the risk is it will spread to the entire one. Therefore, it has to be resected and the viable areas researched. Thank you.